It's kind of hard because we're usually not sitting down. So I get to take a second. So, anyways, welcome everybody. This is the new Trinity Rehab. Obviously, all of the faces are the same except for one. Gina did have left us. She didn't want to because she loved y'all. But this is Brittany. She is our PRN PT that'll be filling in for Gina. So, but basically, we're here to just have some conversations about therapy services. Um, I wanted each discipline to kind of talk about what they do, what they have to offer, something brief and to the point. Kind of wanted to open things up for more question and answers. So we'll go ahead and get started. You guys know me, hopefully, and you know this panel, but I'm Kathleen. This is Lindsay, Crystal, and like I said, Brittany. So I'm going to start with Brittany, and she'll start chatting about physical therapy.
Awesome. Hi, everybody. I know a few of your faces, so it's nice to officially meet everyone. Like Kathleen said, I'm Brittany. I am a physical therapist, and I have been a PT for 11 years. So I specialize in geriatrics, love the senior population, so I'm very, very happy to be here. So just to give you a little bit of an understanding of what physical therapy can do for you. We specialize in fall prevention. We love working on strengthening and balance so that we can try to help come up with solutions if you've had a fall or if you feel like you may have a fall to help prevent another one. We also work on pain management, so anything from neck, shoulder, hip, knee, ankle, back pain. If you've got pain, we can try to help. We also work on if you use a cane or a walker, making sure that it's appropriate for you, make sure that it's adjusted correctly, or if there's anything we can do to make it where you feel like you're more steady with what you're using, or make a recommendation if we think that something else would be better. We work a lot on functional strength, so working on making it easier for you to get it up and down from a chair, make it easier to get on and off the commode, in and out of a car. If you have difficulty with, if you're using a walker and you have trouble getting it in and out of the car, we can try to come up with some ways to make that easier. We work on activity tolerance. So if you feel like, you used to walk all the way down to the tavern for meals, but you're getting a little short of breath when you're doing that, or you like to walk outside and that's getting a little bit tougher to do, we can do some things to try to make that easier. We also focus on strengthening, like I said, balance, and just general getting around. If you feel like you're having trouble doing anything, really, let us know. If physical therapy can't help, then one of the other two probably can.
I kind of had to giggle because she made the reference to the tavern. There's other places that you guys go to as well that you might have.
That's just what I hear about all the time. We're going to the tavern tonight.
So, it's kind of opened up. I want this to be an interactive conversation with you guys. So if you guys have questions about physical therapy, obviously I don't want somebody chit-chatting about their own personal business. If there's something that you guys, want to get with us afterwards and have conversations about, hey, my knee hurts or whatever, we can do that afterwards. But if there are just general questions that you guys have, please, let's make this interactive and please ask them. So, okay. Crystal?
Hi, everybody. I'm Crystal. I am the occupational therapist, one of them. Kathleen is also another occupational therapist here. I've been an occupational therapist for 7, going on 8 years, and I also specialize in geriatrics. I love our senior population. I actually got my doctorate in productive aging specifically for that, because that is important to what I do and what I do here. As far as occupational therapy goes, what is occupational therapy? Because many of them say, I don't work, I don't have a job. Well, you do have a job. You have those daily occupations or those daily jobs that you have to do on a daily basis, whether that's bathing, dressing, going in and out of the bathroom to use the bathroom, managing your home, managing your medications, engaging in those what we call leisure activities within your independent living community here at the village. We work with you on coming up with strategies to help you to do those independently or as independently as possible. Whether that's making home modifications in your house, adding a grab bar, let's say, in the bathroom to help you make it safer and easier for you to transfer in and out of the shower, or get up and down off of your the toilet, putting a grab bar there, or recommending assistive devices there to make that easier. We also focus on strengthening and working on range of motion of the shoulders, wrist, elbow, hand. Hand therapy has been one of our big kind of new programs that we've kind of implemented here. We've gotten a lot of you coming in with hand injuries from carpal tunnel to hand surgeries. So we also work on that. We also can focus on low vision strategies if you have like macular degeneration, for example, and you're having difficulty using your computer or reading your book. We work on giving you strategies and things like that to make that easier, recommending devices for that, modifications to your computer so you can do the work that you need to do. Within the home specifically, we focus a lot on what we call those activities of daily living, ADLs, or what we call instrumental activities of daily living, or IADLs. So, being able to, if you cook, able to cook in your home, we recommend devices to help you to do that easier. Maybe you need to do that from a seated position. We work with you on that as well, managing medications, like I said. Um, so we do a whole, like we encompass a whole wheelhouse with occupational therapy. So if you ever need any of that, just give us a call. We're always here to help.
All right, Lindsay?
Okay. Okay, hi. Which one's better? I'm
Better,
Lindsay, and I'm speech therapist. I've been here at Brookwood for about a year and a half, and it's been great so far. I've been loving it. I work here, and I also work at a hospital, so I'm working all the time with all kinds of people. I think speech therapy is probably a little bit less at face value understood than some of the other therapies. I think people hear that and they say, I speak just fine. Or they'll say that and they'll say, oh, I'll make sure I watch what I say around you. But I promise you, I'm not judging. So I wanted to go over some of the different things that speech therapy actually helps to provide. There's kind of 3 different domains that I do on a regular basis. First one is kind of would be what you would think it would be, is more communication or speech. So that could mean something like, even I'm having a hard time remembering the right words when I'm talking with my grandkids, or I'm at a dinner table and I feel like the conversation goes too fast before I can get what I want to say out. Or if someone has Parkinson's and they feel like their voice is starting to give out on them, they feel like they're not as loud as they used to be, or they can't really sustain a conversation for too long. So that would be kind of more of the speech and communication piece. In addition to, if you, I don't know, maybe if you've had a stutter for your whole life, I could help with that too, but it's a little bit less seen around here. Now, the main thing I do around here that people don't really know about is I try to help with any sort of cognitive decline. Now, as we age, our brain starts to shift and to change in different ways, and it's a natural process that certain things might be more difficult to remember, or, attending the same programs in the same way, and trying to remember the steps to something. As we age, sometimes you notice those things become more difficult, and that's a natural part of aging for a lot of folks, but for some people, it goes a lot faster than others. And so our main goal kind of as a panel here is to try to keep you as independent as long as possible. So what speech therapy would do is provide different sort of, like how they have physical exercise, different cognitive exercise to kind of focus on different parts of your brain to kind of keep them real sharp. So things like executive function. So like if you're still taking care of your taxes, but you notice that's become more difficult, what can we do to kind of like sharpen those skill sets? Or attention, like you can say a story to me and it's in one ear and out the other, or I can never remember people's names. Then we can work on exercises specifically to target that part of the brain and kind of strengthen it. In addition to that, kind of what Crystal was talking about, make modifications to the environment to kind of make it easier to do things. So if you find, hey, I'm having a hard time logging onto the portal, that thing just, I forget what I'm supposed to type in, or I don't know where I'm supposed to log in to go to Aldi this afternoon, I'm just not going to go. Well, we can work together on similar to like what changes can I make to make this physically easier? What changes can I make to just make this simpler so I don't have to go through so many dang steps? So then we can work together on how can I make it easier to remember to take my medication or to remember that I've got a doctor's appointment and things like that, in addition to doing some of these cognitive exercises. So you're making your environment easier, but you're also kind of like sharpening those skills, keeping you as independent as long as possible. And the last area that I deal with is swallowing trouble. So speech therapists kind of like to think of themselves as like experts from here up. Down here, that's their domain. But if you ever notice that you are having a meal and you're finding yourself going or coughing a real lot or just feeling really uncomfortable, sometimes that could be due to changes happening in your throat, which sometimes is a natural part of aging. Sometimes it happens, and it's not necessarily like an expected change. And it's something that could possibly lead to you getting sick or you having to go to the hospital because food or drink could get into your lungs. So I deal with folks and trying to modify their meals or giving them different exercises to strengthen those muscles so that they don't have to do so much of that. And hopefully make it so that they can enjoy the foods they like enjoying as long as possible. I think probably for a lot of you folks that might not be something on your radar as much, but if you're having a meal, try to think of it. Am I coughing a lot with meals, or am I just coughing throughout the day? And maybe talk to your doctor about that too. But that is also part of speech therapy. I know I kind of said a lot, and it's a little all over the map. That's how I feel about my job too. So if y'all have any questions, I'd love to answer them.
As you see, we have a lot to offer up here. Probably something that I need to chat about too is the fact that our services are covered under your insurance plan as well. The process for that is that I go ahead and I do a verification process, meaning I send your cards to my verification person who is in Dunn, North Carolina. She runs your cards. We find out if you have a copay, if you're 100% covered, if you have some kind of authorization process, and we need a doctor's order to treat you guys as well, which we can assist in obtaining one of those. But those processes are all run before we do an evaluation. So we want to be clear that if there is a copay or anything like that, that you guys know before we develop a good plan of care and stuff for you. So I guess with that being said, I'm going to open it up for any questions that you guys have for us.
So raise your hand if you have a question. I'll come
Ooh.
like a little loud. It sounds like I need all of y'all services. I'm just going to sign up now. Anybody have a question?
And if you do have a question,
All right.
Just a general question regarding memory. Do you offer or suggest activities or programs that, I don't know, can help slow the deterioration of one's memory, something like that, or
Yeah.
help it remain better?
Yeah. So if I had the ability to make your brain 20 years old again, I wouldn't be working here. I'd be a millionaire. But there are definitely things that you can do. It's kind of like it's not a pill. It takes work and it takes process. But there are certain strategies you can do throughout your week that kind of compensate for anything, but through that kind of build better habits and better skill sets. And the more you practice something, like a lot of folks that I work with are like, there's so many folks here, I can never remember the names. I go down to the tavern and I feel so terrible because they forgot their badge and I don't know what their name is. And so we go through a process of different strategies to recall people's names easily. And then we kind of work on a system of of accountability, because a lot of times people will see something and they'll think, surely I'm going to remember that. And then it's, phew. So it's kind of, it's a process of how can we build your skill sets to make it so that you're giving yourself better reinforcements to remember for the future. But it is a process. It's not something that happens overnight, but it will be something that should help reduce any sort of progressive decline that you're feeling if you're starting to take like preventative or reactive measures for that. But it is work.
I guess this is more of a testimonial and a recommendation for my friends about what you all do. If I can, maybe I need help right now. I'm on my throat. I'm a tall guy with short hamstrings. And several years ago, I dealt with the long gone Brittany, who worked here, who was very good in trying to deal with a major episode of that. And it was very good, and I felt better, but I didn't follow up. I didn't do exercises that she showed me, that if I'd remembered well and stuck with them, I'd been better off. So I had to come back, had to deal with Sheena, and she sort of suggested that I do a better job of that. And I don't think she liked me. What I did was I picked a couple of key exercises for that particular problem that I could do before I get up in the morning for hamstrings, and I could do it right in the bed before I ever get up, and I've not had a problem in probably at least 3 years.
Awesome.
And I just have a gut feeling that follow up and paying attention to exercise that you can do on your own later can be a big deal. It has been for me.
Awesome. Good.
Thank you for sharing.
And we like to call you the repeat offender.
That's why my wife calls me a lot.
As I was listening to all of you have your discussion about what each of your specialties are, it's very impressive. And that's one of the reasons I was very excited to come here to the village at Brookwood, because of a lot of the services, and they're top notch.
Awesome.
As I'm listening, it's begging my brain going into a direction of prevention and earlier catching, instead of like you go to the doctor and suddenly I need a knee replacement or a hip replacement, or I can't remember, what's your name?
Yeah.
But is there any potential or anything that could happen sort of as a group type session that would help with stability, that would help with those kinds of things that you all do individually, but that we could offer as maybe pre-need, so that it helps me instead of standing in my bathroom, which I do every morning, lifting my legs, moving it over on one leg, so I'm like a stork, so I can maintain stability, but in a more controlled setting. And I don't know what the heck I'm doing. I just do it because I know I don't want to fall down. I don't know if that's something, and again, I'm rambling because it's just coming. That might be your category over there in the brain. But even in collaboration with our wellness center, to have like a 6-week program that cycles. I don't know. But anyway.
I know getting involved with Christy and all that she does over at the Wellness Center keeps you guys going. But the thing is, when you feel like you can't keep up with some of that stuff, that is probably a good time for us to be that intervention, so we can get you back to where you need to be to participate in some of those higher level activities that she has going on over in the I call it the mirror room.
Yeah.
Um,
The aerobics room.
the aerobics room.
Yeah. And maybe starting you on and getting you on an exercise program to at that early intervention, so that way it'll prevent those things from getting, like you say, the balance from becoming so impaired where you're have that increased fear of falling. So we can kind of start early and get you set up on that exercise program.
But it's
So-
all individual.
Correct.
Correct.
Okay.
Yeah.
I was just thinking of ways that it could be more
Like group.
Group.
group-oriented so that you get a buddy, you get a, because sometimes you keep yourself honest.
That is true.
Sometimes what we do is some people get confused with the wellness center equipment because it can be it can be a little bit overwhelming adjusting the seat, adjusting all the bars and stuff like that, and knowing what kind of weight that you should have, how many reps, etc. We actually pick people up to do like an orientation, which is covered under your insurance because we're setting you up with an exercise program. And just go through that stuff with you, pick you up for, a couple weeks to a month to make sure that you're comfortable working on that equipment. I think something too that I would like to preach about is when you guys have like hip replacement, knee replacement, a good thing prior to all of that is to get on a exercise program. You want the pre and the post treatments to both, so picking you up for that would be recommended by us as well.
The stronger you are before having surgery, the easier your recovery is on the backside.
Good advice.
Yep.
Thank you.
The biggest thing that we want to preach here is that we want you guys to age in place. I think that's been the terminology that that people are using. The thing is, we want you to stay in your apartment. We want you to stay in your cottage. And the thing is, we can be that Band-Aid, to keep you there. Nancy.
Maybe a year ago, is that on?
Yes, ma'am.
Yes, yes.
Maybe a year ago or more, there was some discussion about making, with Christy and various folks, about making some videos, taking some film of someone explaining machine by machine how to set the weights, how to move the seat up and down, how to do the reps correctly, and have that sort of thing available for people to view, rather than someone new thinking they want to work out or they've been told they need to exercise on the upper and lower body machines. The Kaiser equipment is not terribly user-friendly. And I know that. But personally, I've learned to use it because I've learned other equipment. I know what to do when I walk in and why, and listen to my body, how many reps, how to do them. But couldn't there be a revisit of that topic, maybe even working with video people from Elon, the kids in the therapy department over there, to get these things produced, make them available in some way to our residents so that, oh, gee, where do I have to go? Whom do I have to speak to learn personally how to do all this? And it's going to take a lot of time. Just a thought.
Okay. We can revisit that with Christy and see where that got left off. Because
She may not have the left off parts,
okay.
but I have emails between people
Okay.
that we were thinking about that, but the idea, I guess it was too big a challenge, got dropped.
Okay. So we could make videos. Okay. Okay. All right. All right. Cool.
You mentioned coverage by insurance. Yeah, our insurance program is through Medicare, and then Humana provides the support to state employees and teachers. But do you need a doctor's direction or prescription?
Yes, sir.
You do.
Yep. Yep, it's a referral, it's a treatment order for PTOT or speech or, whatever the need is for. Yes, sir.
Okay, all right.
Now, the referral, though, can either come from you, you know what I mean? You asking your doctor, say, hey, I'd like to have, services, PTOT or speech. Or we can go ahead and write the order and send it to the doctor, either or. It's, don't get me wrong, it's easier for you guys to do it on your end because you can go into my chart and lickety-split, it comes in. So with us, I'm not saying we're using snail mail, but we've got to fax it to the doctor, and that takes a little extra time. So,
Just to follow up on what Nancy was saying, I think the idea of making videos is fabulous because we do have the portal. People could watch it on their own, I'm assuming.
Right.
Maybe even take their phone with them and say, okay, this is how I do that. I would throw out as a suggestion that if you have someone saying, okay, this is how you set up this particular machine, and you have someone doing it, that perhaps you have one of us being the person that's doing it. Because often I get all kinds of things on reels, and it's like, okay, so this is how to do a chest press, and they're 20 years old.
right.
Which
Yeah.
and that's fine because yes, I'm 75 and I can do a chest press, so that doesn't bother me.
Mhm.
But a lot of people will look at it and say, well, I can't do that. I'm not 20 years old.
Right.
I have to do that differently, but I don't realize that. So just throwing that out as follow up to Nancy.
Yep, you bet. Thank you.
You may know this, but several weeks ago, maybe a month ago, Christy came in and had a better balance class for the folks in healthcare. And that went over like $1 million.
Awesome.
They really appreciated that.
Yep.
And I was wondering if there's some way that she or someone else could do that on a scheduled basis.
That would be something that I would get with Michelle on, right, Max? Yep. I'll pass that on to Michelle and see if she can get that on the schedule. Yeah, with it, you're talking over in healthcare, correct? Okay. That, okay.
I didn't think she came in on a Saturday to do it. I may be wrong about the day,
Yeah,
but they really appreciate that.
okay. I'll pass that on with her to make sure, yeah, and make sure it gets on the schedule. That's a great activity for them over on healthcare, definitely.
I want to put a plug in for chair yoga. That's basically working on yoga poses that emphasize balance. And it's on Friday morning at 11 o'clock. We have a professional teacher who's just excellent. So 11 o'clock on Friday morning, if your concern is balance and also stretching those balance muscles, it's a marvelous class to go to.
Yep, yoga is very beneficial for the body, definitely. Yep. It's at all levels. Awesome. All right. Well, we'll be hanging around for at least 15 minutes or so if you guys have any individual, questions that you have for her. But I appreciate y'all coming by to chit chat with us. We're running around in the hallways. So if you guys need anything, just call us. Our extension is 8222. But yeah, thank you. Anybody else have anything to say? Going once, going twice, sold. I guess we'll all meet in the tavern when we're done, since we brought the tavern up a bunch of times, so. Thank you.
Thank you.
Right.